Many have now received the COVID-19 vaccine, and some of them are waiting for their second dose. Currently, we have 8 kinds of vaccines: AstraZeneca, Pfizer, Gamaleya Sputnik V, Bharat Biotech, Janssen or Johnson& Johnson, Sinopharm, and Sinovac. However, 3 of them are still in clinical trials. Filipinos have looked forward to taking these vaccines. Some would even post it on their social media accounts. According to the statistics from the Global Change Data Lab, as of July 13, 2021, there are already 13.44 million Filipinos, or 8.92% of the population, who received their first dose of the COVID-19 vaccine. With this, some are experiencing different side effects. On today's episode of Lifeline, we are here to learn more about the kinds of COVID-19 vaccine, their differences, and to discuss their most common and uncommon side effects. I'm Zarina Ancheta, your host for today. Come and join me together with the experts to gain more knowledge about the COVID-19 vaccines. This is Lifeline. We improve our lives by feeding our minds. As Filipinos are known for their humor and love for comedy, some of them made a meme about people who received their COVID vaccines. But jokes aside, many are still hesitant to undergo vaccination due to different experiences reported by those who have been vaccinated, such as exhaustion, headache, fever, and more. Together with me is Dr. Karl Evans Henson, who is an infectious disease specialist, an alumna of USD's Faculty of Medicine and Surgery, and a director of the Hospital Infection Control and Epidemiology Center from the Medical City. He is here with us today to help people better understand what are in the vaccines that cause various side effects among individuals, how to handle them, and avoid the feeling of panic or fear. Hi, Dr. Karl. Good afternoon. I hope you're doing great. Thank you so much for being here with us today.
Hello, Charina. Good afternoon. Thank you for having me.
So, Doc, a lot are still curious and confused about the vaccine. Can you please tell us the side effects of each kind of the COVID-19 vaccine to the body?
All right. So I'm sure by now, a lot of you are already aware about many different what's called platforms. For example, Sinovac is an inactivated vaccine. mRNA vaccines, an example would be Pfizer and Moderna. The side effects for all these vaccines are pretty common and are across the board, regardless of the brand or the kind of vaccine. The most common side effects include what's called reactogenic symptoms. So the vaccine itself, the work of the vaccine is supposed to expose your immune system to either a part of the virus or the whole virus. And the end goal is that your body memorizes the features of this virus so that the next time or the first time that you're exposed to the actual virus, you won't get sick, or you'll get sick but with a very mild symptoms. So it's expected that you will exhibit some symptoms that are related to your immune system, churning out the protection. Okay, so these are very common symptoms like pain in the injection site, swelling in the injection site, some heaviness in your arm maybe. Some patients report fever and flu-like symptoms a day after the vaccination. The more worrisome side effects include those of allergy. And actually, if you develop very severe reactions to the first dose of the vaccine, a condition called anaphylaxis, you're not supposed to get the second vaccine anymore. But based on data that we have from the DOH and actually all over the world, while there are very severe side effects in some of these vaccinations, some of these vaccines, these are very rare. In most cases, they're very mild and will resolve within a day or two.
Okay, Doc, why do you think every vaccine side effects differ from the other? Does it have to do with the content of the vaccines or is it because of a person's condition?
I think it's a combination of both, but we just need to make sure, that the differences between vaccines. For example, some issue about clotting, that they found with viral vector vaccines, which is not really found in inactivated vaccines. It's possible that it has something to do with the composition or the technology used. No? But I don't think that anyone is absolutely certain about why there are differences. We do know that there are some side effect profile differences, but these are very minor and very rare. In general, all the vaccines act the same way. It acts to protect you from COVID, especially severe COVID and death from COVID.
Thank you for that clarification, Doc Carl. Have you heard of appalling encounters from people after receiving their first dose of the vaccines? If so, can you share these reported experiences?
Yeah, so we have been in Medical City, we have been vaccinating, or we have vaccinated all of our employees. When we gave out the first dose, there was a resident who developed severe allergic reaction to the vaccine that she had to be brought to the ICU to be monitored. No? But she was fine a day later. Her blood pressure had really just to be monitored. So it's important for people to know that there are possible side effects, yes, and there are mechanisms in place to monitor for these side effects. But the message here that's more important than the side effects really is when you weigh the risk of getting a very rare side effect versus the benefit that you will get from getting vaccinated and getting protected. No? So think of it as a scale. So on one hand, you have the risk of getting a side effect from a vaccine. On the other hand, you have the benefit of protection. No? When you weigh them, mas matimbang the benefit of getting protected is still much weightier than the risk of getting a rare side effect. So, yes, there are side effects. Yes, there can be some pretty major side effects. But when you weigh it against the possibility of dying from COVID, parang it pales in comparison.
In some LGUs, they're already giving out vaccines to those who are under the A14 according to the prioritization list given by the DOH. Are there any things, Doc, that we need to do while we're waiting for our second dose?
Nothing new from what we're supposed to be doing without the vaccine anyway. No? Remember, when you get the first dose of the vaccine, yes, you do have some amount of protection, but the protection is not high enough and not long-lasting enough to protect you for, properly. So you do need to get your second dose of the vaccine, and while waiting for the second dose, you're still expected to observe the minimum public health standards: mask wearing, hand hygiene, physical distancing, face shields, etc. Do things outdoors more than indoors, etc. So these things that we are practicing, the minimum public health standards, they have been tried and tested that they will protect you from COVID-19. So while waiting for your second dose of the vaccine, you need to make sure that you continue to practice these habits. But more importantly, after you get the second dose, that is not licensed for you to stop practicing these public health standards anyway. Not until we are able to vaccinate more people within our communities. I think that's the only time that we can really loosen the restrictions in terms of mask wearing and physical distancing.
I agree, Doc, because honestly, through social media, we can see that some people expect that after getting their first dose or even just the second dose, they feel like they're really immune already. However, I think it is really important to remind them that it doesn't stop there. Just because you're already vaccinated, you have to stop washing your hands frequently or using alcohol or even wearing of face masks and face shield and even practicing of social distancing. I think that's really one thing that we must continue to impart to them because that's what they forget po eh. It's like if they think that just because they get vaccinated, oh, I will be fine, which is wrong. And I think that is really seen through social media. And good thing is that some organizations or even local government units remind them naman po. And I think that's one way of maximizing social media platforms to keep in their minds that the virus cannot be entirely stopped just because of the vaccine, but it's being one step ahead of being safe.
Yeah.
Next po, given the fact that there are still those who are afraid of undergoing vaccination due to the variety of experiences, what can you say to those people for them to receive enough reassurance or feel encouraged to get vaccinated?
I think by now we've gained enough evidence. No, the DOH is reporting that we have vaccinated a little more than 9 million Filipinos. And outside, in the US, many more millions have received these vaccines. And across the globe, you will find in the WHO website how many people have already received the vaccine. And the overwhelming report is that these vaccines are safe and that these vaccines are very effective in protecting you from COVID-19. Yes, you can still get COVID-19 after you get vaccinated, but the likely picture is that when you do get sick from COVID after you get your 2 shots of vaccine, more likely than not, you will get only mild illness, and it will prevent you from dying. There will be, I can assure you, there will be some people who will absolutely refuse. Their minds are made up. We are not after those people. No, what we want to happen is for those who are still on the fence to be convinced and change their minds and get vaccinated. So the overwhelming evidence about these vaccines, they're very safe and they're very effective, even with the new variants that are coming out. So I really hope that this message comes across loud and clear. Please get vaccinated.
Of course, it's very important to understand the importance of vaccine, especially it's been over a year since this happened. Thank you for your insights regarding this, Doc Karl. That was a fruitful start for today's discussion. I'm sure that the audience learned a lot from you. After this short break, we will be hearing from the Tamashan community regarding their experiences about the first dose of vaccine. Stay tuned and we'll be right back. There are already lots of Filipinos who got their first dose of vaccines, and some of them are our fellow Tamashans. With that, we have asked the Tamashan community from different faculties and colleges regarding their experiences and initial thoughts on the COVID-19 vaccines. After each video, Doc, we would love to hear your thoughts, comments, and or suggestions regarding the experience that they have shared. Our first Tamashan guest, who was vaccinated with Sinovac, will be sharing how initially she had other choices of vaccine in mind. Let's all find out why.
I was vaccinated with Sinovac last May 25. It was not my first choice, definitely, because I had my reservations. I am a person with comorbidity, so it's pretty reasonable, right, to have that reservations. A few days before my schedule, I saw this article that is saying na may literature na yung Sinovac. So I read it, and to summarize, very effective. So nawala yung worries ko and I pushed through with it. After that, okay na, parang I feel confident na somehow. And may relief na rin. Although first dose pa lang yun. And yung second dose, yun talaga yung that will seal the deal entirely. Pero may relief talaga siya.
So, Doc, she mentioned how the existence of literature helped her feel confident about the type of vaccine she received, especially considering the idea of being a person with comorbidity. How significant and reliable do you think these articles are when it comes to sharing information about the COVID-19 vaccines?
That's a very, very important question, Trina. And I think as students, no, it is critical for you to be able to discern which sources are reliable and which are not. As you already probably know, Facebook and the other social media pages these days are filled with inaccurate information. And there is a very intense drive by these companies, Facebook, Instagram, to really try and filter out fake news and propaganda. You know? So we really, really need to be discerning about the kinds of sources that we get our news from, our information from. So you have the usual journal articles and review articles that you can get, you know, from reputable sources, infectious disease journals, internal medicine journals, or for lay people, yung mga established na magazines, science magazines, etc. The establishment news articles and things like that, no, should be able to provide you with reliable and accurate information. Sometimes, I'm sure you by now, especially you guys, you're much more tech savvy than we are. By now, I'm hoping that you will be able to spot, fake websites, troll websites. Sometimes they're very easy to spot, but for the untrained eye, they're not. No? So we always just need to take whatever we read online with a grain of salt.
I agree, Doc. It's our responsibility actually to be careful and of course to be literate on what we see through social media. Next, let's listen to the various experiences she had after taking her initial dose.
My experiences after the initial vaccine, it was not good because I feel like I experienced the severe effects of the vaccine. I had fever, I had cough, I had colds, I lost my sense of smell, and naging matabang yung panlasa ko. Everything is so matabang. But I researched about it and it was fine. It was also experienced by other people who had other doses, other brands of vaccine. It's normal since yun nga, the vaccine is letting my body fight the virus that was placed there, kasi nga yung Sinovac is parang deactivated yung virus na nilagay sa yun yan eh. So it was letting my body fight and make antibodies for COVID. So it means that the vaccine is working.
Doc Karl, that sounded like she already somehow went through several symptoms of people who have been victims of the COVID-19 virus. How is that possible? Did it have to do with the fact that she has comorbidities, or were it the ones she found out through research, such as how some vaccines provide the activated virus?
Okay, so this is, I think this provides us with a stark example of really trying to discern our references, no? The symptoms that are expected after a dose of vaccine, whether it's an inactivated virus or mRNA or some other platform, no? The usual side effects are what's called reactogenic, reactogenic, reactogenic symptoms. No? And this does not include cough and colds. This does not include loss of sense of smell or taste. Reactogenic symptoms include pain in the injection site, swelling, and some heaviness in the injection site. And you can also get some fever, headaches, body pains, no? But definitely it should not result in you getting some respiratory symptoms. So I suspect that Elise actually might have developed or got infected with COVID and had actual mild symptoms of COVID. Remember, she's saying that she only really got the first dose pa lang. No? So it was very possible that at the time that she got her COVID shot, she was already incubating the virus, and then it manifested after she got her dose of vaccine. The manifestation after she got the dose of vaccine has no relation with her getting the vaccine. We have had many patients who, after their first dose, developed COVID. And when we traced back the source of the infection, sometimes it's in the vaccination site. Now that she can tell her story like this, it seems that she got better and she was blessed to have recovered without any problems. So I do want to just clarify that I don't think that her loss of smell and taste and her respiratory symptoms were because of the vaccine. I suspect that she developed COVID, the actual infection, after she got her first dose of vaccine.
Okay, Doc. Thank you for that clarification that it may have not something to do with the vaccine, since you've said she just got her first dose of vaccine. The second guest from our Tamashan community was vaccinated with AstraZeneca, while the other received Sputnik V. They will be enumerating reminders that were given to them by the experts after acquiring their first dose. Let's find out what they are.
I was vaccinated with AstraZeneca last May 20, and first advice that was given to us by the medical expert is, iinom kami ng paracetamol every 4 hours kapag nagkaroon kami ng fever. Then second, we can't drink any caffeine. And of course, the most important advice is staying at home, kasi even if we have the protection, the virus is still there and we still need to be responsible.
I was vaccinated with Sputnik 5 last June 3, 2021. So while waiting for our second dose, dapat this June 24 siya, kaso wala pa raw stock sa ospital ng Sampaloc. So wala namang masyadong reminders bukod sa wag mag-take ng alcohol or yung mga bisyo, ganun. Wag mo nang mag-take ng mga ganun while waiting for the second dose. Pero the rest naman, like restrictions sa food, limitations sa food, sa lifestyle, wala naman masyado.
It seems like some of the advice given to them by their doctors differ from the other. Do they really vary depending on which type of vaccine they have received?
Okay, so the advice is pretty standard regardless of the vaccine that you receive. After you get the vaccine, if you do get a fever, you can take paracetamol. But it is not advisable for you to take any paracetamol or any anti-fever medication or any anti-allergy medication before you get vaccinated. Because it might blunt any side effect reactions that you might exhibit after. So after a vaccination, yes, you can take an antihistamine or an anti-fever medication. And that's pretty much it, no? Ako, personally, I don't advise anything else to my patients. Now, the two guests mentioned something about not drinking caffeine, not drinking alcohol. There's really no data about that, but I guess it's prudent to avoid alcohol maybe within the first 24, 48 hours now. But if you drink alcohol in moderation and you want to do it right after you get the vaccine, I think it's okay. The issue with alcohol, for example, is it can suppress the immune system. but only if you take it in excess. No? So if it's moderate drinking, I don't think that we need to issue such stern warnings about not drinking alcohol like until you get your second dose. So parang there's really no basis for that in the literature. But common sense na lang din siguro, no? Within the first 48, 72 hours, just avoid anything that might cause you problems, that might muddle the picture after you get vaccinated.
Okay, Doc. Thank you for clarifying that once again. Again, thank you to our guests from the Tomasian community and of course to Dr. Karl for sharing his time and such valuable information. I am sure that our viewers learned a lot and realized a lot because of your clarifications and are now very much enlightened about vaccines. It has been a year and a half since this pandemic started. Luckily, we already have vaccines here with us to protect us and lessen our cases. In this episode of Lifeline, I hope that you have learned more about our vaccines through the experiences of our fellow Tomasians and through our guest doctors. Once again, I'm Zarina Ancheta, reminding you to get vaccinated and encourage your family members as well. Because as they say, #vaccines work. This has been Lifeline. We improve our lives by feeding our minds. See you next time, Tigers!